Hi viewers, this is me, Dr. Buland Iqbal, and the podcast is Be Fit with Dr. Buland Iqbal. Today I have the honor to have with us not only my teacher but also head of Department of Preventive Cardiology, National Institute of Cardiovascular Diseases, NICVD, and a great cardiologist, expert in angiographies, angioplasties, and so forth and so on. So it's a very exciting day for me today to have him here on this podcast. We have with us Dr. Khawar Kazmi, whom I'm going to welcome. Assalamu alaikum, sir.
Assalamu alaikum. Thank you very much for inviting me here and giving me this opportunity.
So it's a great pleasure and honor for me to have you here on this podcast. Viewers, you must have seen a common trend of young deaths, especially deaths among those people who are very fit and healthy, or they are doing exercises, going to gyms, but still we certainly get the news of their deaths, may it be from the cardiac issue or some other, but it's an alarming situation where we are getting these news. Either it's because of the ways of communication that we are being informed so rapidly about even deaths happening across the border, even in our country. We are continuously seeing that the onset of cardiac disease or the occurrence of cardiac arrests have increased quite a bit. What are the reasons and how can we prevent it? Today we are going to talk about it. And in fact, we are going to talk about what is actually a cardiac arrest. Sir, I would like to ask you that these sudden deaths and we come through news that, this young individual or that young artist, famous artist, there are famous actors, actresses who are going through this and they die very young. So what is it actually, the actual cause is a heart attack or a cardiac arrest or some other disease related to brain deaths or anything else?
Okay. So let's first, I think, talk about the terms which we use here. One term is which you've been saying, sudden cardiac death. So basically, what is sudden cardiac death? If there is a sudden death without any preceding signs or symptoms, then we say it's a sudden death. And majority of the sudden deaths are because of cardiac issue. Okay, so what are the cardiac issues? We'll talk about that. But before that, maybe, two other terms which one you have used and one I'm going to just explain. One is cardiac arrest. So cardiac arrest is also basically the same thing when the heart stops working. Okay, so it's cardiac arrest. If you can be resuscitated out of cardiac arrest, then it is not a cause of death. Otherwise, it can become cause of death, right? So, the other term which I would like to explain, because sometimes there's confusion about it, is heart failure. Many people are told that you have heart failure and they are really alarmed that they feel that I'm going to die. So, heart failure is the term used when heart is not able to do what it is supposed to do efficiently. Right? So if there is weakness of the heart, it's heart failure. It's not that that person will immediately die or heart will stop working. Heart will still continue to work, but it will not be able to meet the demands of the body. So that's heart failure. So sudden cardiac death, talking about that, and as I was saying, it's the cardiac arrest which happens, which causes the cardiac death. What causes cardiac arrest? Most of the time, we'll see the heart has an electrical system in it. Right? It's basically a pump which is supplying blood to the whole body. So it's made of muscles. But to work rhythmically, like we know that we see our pulse, it's 70 beats or 80 beats per minute. So every minute heart is beating 70 times or 80 times. To do that, there is a very elaborate electrical system within the heart, which is driving this muscles to move, and they have to move and then relax. Every time they move, they relax. It's because of an electrical current circulating through the body. So whenever their electrical current is abnormal, it becomes too fast, or there is no electrical current, either way. So there's no electricity in the heart. So as we commonly see in Karachi, that God has made alternate systems. They are, I mean,
There are
alternate
power outages
outages.
in the electrical system of the heart.
Right. So God has made alternate systems also. There are generators which can then start working. But if all the generators fail, then the heart would arrest. It is not working. So it's not working at
Like
all.
there is a secondary pacemaker in the heart,
They
which
are
are in the lower side of the heart, which are called ventricles.
Yeah.
The heart is not going to beat 72 times, but it can beat 40 times or so to keep the life going on.
Yeah, but that's not cardiac arrest. But if there is no electricity at all in the heart and heart stops pumping, it's cardiac arrest, right? This will, if not resuscitated, this will lead to death because within 2 minutes, if brain does not get blood supply or oxygen, brain starts dying. And once brain is dead, then it is legally or medically death, as we call it. If there is a cardiac arrest within hospital, there are possibilities that you can do resuscitation. Immediate resuscitation is when you start compressing the chest and you kind of start heart to pump again, not automatically, but because of your compressions. We see that in the films or a common man, or we may have seen it. Sometimes we give a shock to the heart to restart that electrical activity. And if that resumes electrical activity, then you can kind of avoided the death which would have resulted automatically. In Pakistan, we don't have any such system, but outside the countries, we may have some people who have witnessed outside at the airports or even in the malls or public places. You see the sign of an electric current and there's written IED. It's a automatic defibrillator. So what is that? That same kind of machine which we in the hospital we use to shock the heart, to restart the heart. That's a smaller version of that, and you attach to the patient who has a cardiac arrest, and it will automatically detect what the abnormality is and give a shock, right?
Okay.
So it's called, bystander resuscitation. And many people, especially those who are in public duties like police officers or other people, they are trained on resuscitating people or use of this IED to resuscitate people. So outside there will be many people who may have had a cardiac arrest at a public place and they are resuscitated and a death is avoided and they are referred to a hospital for further management. In Pakistan, unfortunately, we don't have any such system. So if there would be a cardiac arrest, even in a public place where there are people who are witnessing it, unfortunately, most of the people are not trained to do that. So, as I was saying, what causes cardiac arrest? It's lack of electrical activity, or sometimes there's too much electrical activity. It's a bizarre electrical activity. Rather than coming in a systematic manner, heart is what we call is fibrillating, right? Normally heart should be pumping like that. Fibrillating is there's too much electrical activity coming from every side and heart is unable to then decide, so it just keeps on doing this. This is fibrillating. So when it's doing that, it is not able to pump any blood. So so it is same thing as no electrical activity or cardiac arrest. So these are the two basic rhythm electrical abnormalities in the heart which causes cardiac arrest and then leading to sudden cardiac death.
So now coming back to the point, you said that it can be prevented if people are trained, and the training is called basic life support, which is BLS.
Yeah.
Does in Pakistan these BLS trainings exist? Your organization, National Institute of Cardiovascular Disease, one of the biggest cardiac organizations in the whole country. Are you providing any BLS support, BLS courses to common men who can come and get this training of basic life support?
Unfortunately, yes, we do have that facility. We have a skills department and we do provide courses for basic life support, and the other one is advanced cardiac life support, which is for medical professionals. But resources are so limited that unfortunately at this time, even in Pakistan, the health professionals, all the health professionals are not even trained in basic life support. Okay, in some institutions, it is mandatory for those people who are medical or paramedical people to have at least some training. But everyone working in the hospital is not necessarily trained in basic life support. So leave alone the common man. There are random efforts where we do some courses for, say, law enforcement agencies like police or rangers, but it's not a systematic program where we would know that every police man or every ranger professional is trained in basic life support. So unfortunately not. And it's not just one-time training because you are not doing
It's
it.
a continuously validating training which
Exactly.
needs to be validated every year or after every 2 years.
2 years.
Even the doctors have to get their certificates
Exactly.
validated in order to continue practicing.
Yeah.
In some of the organizations abroad or in Pakistan,
It's mandatory.
it's
Yeah,
mandatory.
right. Because I think you have to remember it's a skill. Skill is only you do it well if you are doing it regularly.
If you practice it.
Practice it regularly. And here, I mean, it is not a regular practice. You are not resuscitating someone every day. So that's why, I mean, I may not have resuscitated someone in last 1 year. So I would lose that skill. So that's why it is mandatory that every 2 years you have to renew your certification. So that
And
you
refresh your knowledge so
refresh.
that you again get the skills to
Exactly,
resuscitate.
exactly.
Now, sir, I'm coming back to the certain cardiac deaths or certain deaths. I'm going to ask you that is it just related to the rhythm of the heart getting stopped, or it is secondary to a heart disease, or you can say ischemic heart disease, which is less blood flow to the heart muscles, they get fatigued or they get low oxygen, and that's why due to that they start dying and the electrical system passing through them gets disturbed.
Yeah. So, just saying, I think cardiac arrest will always be because of electrical abnormality, as I have already explained. What causes that electrical abnormality? That's where the causes come in. And that's where I think almost 97, 98%, yani out of 100, 97 or 98 electrical abnormality or cardiac arrest happen because of a heart attack situation. So it's the ischemic heart disease, as we call it, or acute heart attack, when the blood flow to a certain area of the heart muscles is suddenly cut off, and it creates damage to those heart muscles, and that damage starts an electrical abnormality, which is most of the time very fast rhythm or fibrillation, as we are saying, and that causes cardiac arrest. So that is the most common cause of cardiac arrest, as we say. Very rarely, as I say, 97, 98%, so 2 to 3% situations are different from that. That could be primarily and heart's electrical abnormality. There's an abnormality within the heart's electrical system, and most of the time these changes are by birth. Sometimes there are different situation with the heart arteries. The way the heart arteries are made or the course is, it is abnormal, and in certain situations it gets blocked, it cuts off the supply to the heart muscles, and then it causes. So it's not ischemic heart disease where there are blockages within the heart arteries, it's by birth abnormality, or what we say congenital abnormality, either in the electrical system or in the heart arteries or in the heart muscles, which can cause an electrical abnormality to cause cardiac arrest. That happens very rarely, but it has happened in some athletes also while playing their games. And because, I mean, they are celebrities and they are news, and it becomes very common and everyone gets scared of. This is a very uncommon situation. It's not a common situation. Okay, common situation is still ischemic heart disease, those blockages in the heart arteries, and I think that's where we need to concentrate, because those deaths are mostly preventable. Ischemic heart disease death is preventable.
Preventable.
Ischemic, if you have by birth abnormality in the electrical system, that may actually sometime be preventable also, because you can detect that when we do an ECG in a normal individual. And there are some abnormalities in the ECG which hint us towards an abnormality in the electrical system, and further assessment of the electrical system will tell us what the abnormality is, and then we can take corrective steps or preventing steps, for cardiac arrest. Similarly,
So when should we have our first ECG done? For anyone who is a young guy, when should he have a first screening ECG done? Even if he is not having any cardiac pain or any symptoms, should we get a baseline ECG done?
I think ECG is such a simple test. So, I think generally we would say I do have an elaborate test. When we do, so we see the cost effectiveness ratio and whether what kind of, X-ray, there is an exposure to, on X-ray exposure to the body, whereas on ECG there is no harm in getting it done. So, if there is some indication even in the children, we can have an ECG done even in the children, like if they have palpitation or feeling of heartbeat, or if their heartbeat is too fast or too slow. So first thing is actually examine a patient. Doctor should examine a patient. If they find an abnormality in the pulse, too fast, too slow, irregular, should get an ECG done. I won't advise that a person should just go on his own or her own and get an ECG done. I think consult your physician, let him examine or her examine you, and then if they find any clue, ECG is a very simple basic test, it can be done right from there, and some clue can be done. ECG is not an absolute, no test is absolute.
It's not diagnostic. Absolute diagnostic.
Yeah, in certain situation it is very helpful. We very often do I had chest pain and next day I went and got an ECG done and ECG was normal, so I'm fine. Okay, doesn't mean anything.
It does not exclude that you don't have a heart disease 100 by 100%.
So every test has its own limitation, and it is only useful in certain situations.
Its own false negative ratio and false positive ratio.
Exactly.
Now, sir, I want to ask you that many people say that after drinking coffee or something, or 2 or 3 cups of coffee, they start feeling palpitations, they start feeling heart rate increased, or sometimes they feel a missed beat, which is called premature ventricular contraction in medical language. Does these things make a person prone to having a cardiac disease or a cardiac arrest?
Not necessarily. Not necessarily. You have to see is, how the heart rate is controlled by the body. So when I'm like sitting here, my heart rate may be 60 or 70 or 80. If I would exercise, my heart rate would go up. How would it go up? So the brain recognizes that my body needs more blood, and it directs the heart to beat faster so that more blood can be
according to the requirement of the body.
Exactly. So how does brain direct the heart to do more? One, it has nerves which are going to the heart, and that it can send signals to the heart to beat more faster and stronger. But there are also chemical substances which are released in the body which will make this happen. So catecholamines we know very common.
Catecholamines, like in fight and flight situations.
Exactly. So there are these kind of substances which are released by the brain to make changes in the different organs of the body. So when we have like strong coffee or coffee on an empty stomach, because this has caffeine, and caffeine can stimulate more catecholamines in the body, we can have a faster heartbeat even in normal individuals. Many alkaloids can do that. Alkaloids means, one very famous alkaloid which can do that is licorice. Licorice is that black substance which you commonly find in candies and things. So it's mulati हम बहुत use करते हैं. कफ सिरप्स में मुलट्ठी बहुत यूज़ करते हैं, तो मुलट्ठी इज़ ऑल्सो एन एल्कलॉइड. बीटल नट इज़ ऑल्सो एन एल्कलॉइड, इट रिलीजेज एन एल्कलॉइड. जो आप छालिया खाते
When you eat betel nut or pan or anything, then you feel a little heaviness
you can,
or
right? So
that's
these
why.
are the alkaloids which are released from these natural occurring things, and these can cause me to feel more heartbeat, and different people are prone in a different way. Some people can tolerate a lot of coffee, other people can't. Like I can't have coffee, I can have tea, but anytime I have coffee I will feel palpitation. Okay, that doesn't mean I have a heart disease. That is the way I am, right?
Your receptors are more sensitive to
Exactly.
caffeine. That's
So-
why you get more heart rate as you drink coffee.
Exactly. So every human being is different from the other way. But I mean, many people would ask this question also, that I mean, I have more, my heart rate is a little more when I'm resting. It keeps, generally it's around 100 or more than 100. Yes, I mean, some people may have a higher heart
Resting
rate.
tachycardia.
That's the way they are, because they are releasing more catecholamines in the body. That's the way their system is. So how do you naturally make it better? Exercise is the best way, because athletes, seasoned athletes, they have a very low resting heart rate, because it prepares them to do more physical activities when they have. So that is the thing for normal people. So I mean, having palpitation does not always mean that you have a heart disease.
Sir,
Feeling
is black coffee really beneficial for heart?
it-
And if yes, then how many cups?
It-
Because nowadays people it's a sort of a status symbol, or
Yeah.
you can say a style, or people drink black coffee and say that it's very beneficial for heart. Sometimes they drink 3-4 cups.
Yeah. It has shown that there are some benefits, but in moderation. Okay. In tea, there are also benefits, but it's green tea which is shown to, or black tea without milk, which has shown to have the benefit. Because both of these, it's not the caffeine which makes you, it's the flavonoids or antioxidant substances which we have both in coffee and in tea. But unfortunately, those antioxidants, when they are mixed with milk, then they lose their effectiveness. So that's why black coffee is considered a little better for health, but moderation. I mean, 1 to 2 cups in a day should be good enough.
Okay. Sir, now coming back to the prevention of certain
Yeah.
cardiac deaths or certain cardiac arrests, are there any tests available which can tell you that you are going to have a heart disease in near future? For those who have got a family history, or their lifestyle is sedentary, or even if they are fit, but they are just curious to know, that are there any tests available in the medical field which can tell them?
So, I mean, as we said, I mean, the commonest cause of cardiac arrest is these blockages in the heart arteries. So, how do you prevent those blockages in the heart arteries? So, the thing is, I mean, the causes of these blockages in the heart arteries are, I mean, 2 categories. One is non-modifiable, as we call it, like family history. My father had heart problem at a young age, so I am also now prone to have that problem at a younger age. But then there are, like with age, in male sex there are chances, in female after menopause the risk of heart disease goes up. So that is non-modifiable risk factors. But then South Asians are, I mean, we as a race, we are more predisposed to but then also there are more modifiable risk factors. And we know that 80% of heart disease, these blockages in the heart arteries, can be prevented if we control the modifiable risk factors. Even in families, it's not just that I share the genes. I also share the environment. I also share the same habits, same kind of food, same kind of activity. So what are those modifiable risk factors? High blood pressure, abnormal cholesterol levels, diabetes or high blood sugar, tobacco, use of tobacco, lack of physical activity, lack of use of fruits and vegetables, and central obesity. If you have more fat in the tummy. So these are all risk factors which contribute to those blockages in the heart arteries. So we need to be looking into these blockages, how to prevent these risk factors, to control these risk factors so that we don't have those blockages, and then the risk of sudden cardiac death or a heart attack would go down. So how do we know these risk factors are? First thing is, how do we know whether I have high blood pressure or not? Especially if my family has any of these risk factors, like my father had high blood pressure, I am prone to that. How would I know if I have a high? All of these factors are silent diseases. They do not have any symptoms. So if I am feeling absolutely well at the age of 20 or 25, does that mean that I don't have any of these risk factors? I don't have hypertension, I don't have diabetes, I don't have high cholesterol level? No. It is possible I have it. How would I know? Have yourself checked up. So if my family has any of these risk factors, I should have myself checked starting from age 16. Even
From age 16?
Right. If my blood pressure is absolutely...
And how often, like
right,
annually?
That's what I'm saying. If my blood pressure is absolutely normal, less than 130/80, absolutely normal, check it every 2 years at least. Get it checked every year. If your cholesterol is absolutely normal, your blood sugar is absolutely normal, you can check it after 5 years. As the age goes up, the frequency has to be more frequent because the risk is going up with the age. But if I have an abnormal level, if my blood pressure was say 135 and I'm not sure, I would check it every 3 months, 4 months, 6 months, not wait for 2 years, right? Because it is now already alarmed that it is an abnormal. It's not the treatment which is going to make you feel bad or make you, it is the prevention of these things and controlling these, if with medication or with lifestyle, which will save you for the future. So in these silent diseases, we are checking it, we are knowing these, we are treating these for our safe future. It's not for today. It's not how I feel today. It's how I am going to be 5 year, 10 year, 20 year later. So it is important that if I have problem in my family, I'll have myself checked up at the age of 16, 17, 18, 20, not wait for 45, 50, or when I'll have myself checked when I have symptoms. No, there will be no symptoms. Heart attack is a complication of these problems. It's not a symptom.
So we need to get ourselves checked before the problem arises.
Exactly.
Okay. Now, sir, I would like to ask you that you said that the females normally have heart disease after the crossing the age of menopause, which is around 45 to 50 years. But can females become heart patient before the age of 45 or 50 years?
Yes, they can. You can. I mean, if they have more risk factors, like if they have diabetes, then that natural, why do they have after menopause? It's the female hormone, especially estrogen, which gives you a protective edge, right? So these protection loses its effect if you have other strong risk factors. So those who use tobacco, and I think we didn't mention tobacco in our previous risk factors. I think that's an important risk factor. Any form of tobacco, not just cigarettes. Any form of tobacco, whether you smoke it, whether you eat it, whether you chew it, whatever way.
What about the nicotine patches, which are or the nicotine?
That also has
chewing gums.
That also has nicotine in it. So it is still harmful if you continue to use it. Nicotine patches or nicotine gum has been made to withdraw from the cigarettes, not for regular use.
Okay.
So if you were smoking and you change to a nicotine patch or a gum, now because of hydrocarbons in a cigarette, you also had risk of lung cancer.
Lung cancer.
That risk would go down, but the risk of heart disease would stay because of nicotine. So that's why
these vapes, which are going vapors and all that.
Vape
and the shisha.
Shisha was as bad as tobacco. It's like hookah. We used to have hookah.
And what about vape?
Vape was also initially made to withdraw from smoking, to help people withdraw. Unfortunately, it has now become, so that shows that how addictive it is. So in vaping, one, it has, many of the vape solutions have lot more nicotine than actually it should have. So it's as bad as the cigarette. Second, there are also other stabilizing ingredients or those things in the vape liquid which directly causes lung damage. So those, we know instances there where there were instances of binge vaping. I mean, people have, and young people having death because of acute lung damage. So it not only causes, I mean, more nicotine and heart damage, it causes directly lung damage.
And respiratory diseases.
I just heard, I mean, yesterday there's a new vape solution which is derived from a natural tree. It's called 5OH, and it is even more addictive than
the
heroin,
normal vape.
than
Or
heroin,
cigarette.
than heroin.
Heroin.
It's even more. It is morphine-derived ingredient, similar to that, and it's even more addictive than this. So vaping is not a simple thing. It's
It's
very
not a good
dangerous.
thing or not. Just to
dangerous.
quit smoking, it's all right, but to have it used regularly is going to give you harm.
So women, if they have diabetes, if they have multiple risk factors, or if they have tobacco use, then they may lose the benefit of that hormone protection until the age of menopause.
Sir, what is calcium score? And should everyone get a calcium score before becoming a heart patient?
No. First thing, as I was saying, I think no test. Test is all the investigations are to help the physician make the right diagnosis. No test should be done by patient themselves or common man themselves. So calcium score, the same thing. It's a very simple test, but the problem is how do you interpret it, right? So we talk about the calcium score. I mean, what are the indications now at this time for calcium score? So we do risk assessment of people. So we categorize those risks depending on their traditional risk factors like diabetes and blood pressure and whether they're using medication or tobacco use. We categorize them into low risk, intermediate risk, or high risk. Only indication of calcium score at this time is those who are in intermediate risk. We want to know more about them so that we can decide whether to start medication right now or we can wait some years. In low risk, we need lifestyle factors, no medication, and that is definitely there. Intermediate risk, if calcium score is normal or zero, then we can continue with lifestyle factors, but if calcium score is elevated, then we have to start action right there and then. In high risk, we have to start action anyway, so there is no role of calcium score in that situation. What is calcium score? I can also then explain after this background. On a CT scan, the CT scan has ability to pick calcium if there are even specks of calcium in the heart arteries. Why do calcium goes there? Calcium by itself is not the problem. Calcium is only a repairing process. So when there are fat deposits in the heart arteries, body will feel that the artery has become weak there because it has fat. Fat is weaker than the normal situation. So it perceives that it is weak. It tries to repair it. It repairs it with fibrous tissues and then deposits calcium on top of it. So calcium is actually a response to that fat deposit, not a primary problem.
And this is how a fat deposit gets calcified.
So we will only pick it when the fat deposit has become calcified. So zero calcium does not mean that there are no fat deposits. So we know that under the age of 40, calcium score has very limited value because the fat deposits, even there, are not there long enough to have a calcium deposition there. So that's why you can't pick it. So at this time, the recommendation is only after the age of 40, between age of 40 and 60, and those who are intermediate risk.
Intermediate.
Over the age of 40, most of the people will have some calcium anyway.
So some people say that, I would like to ask you through your experience, that those who have blockages in the artery, they start drinking syrup called Nuskha Qalb, which is made from apple cider vinegar, ginger, garlic and honey. And they drink it with warm water on empty stomach in the morning.
Right.
Does it clear the arteries?
We don't have any research where it shows that it has cleared the artery. So either medical or non-medical, there's no research. The problem, I think, why do we do research? I think, and what is this anecdotal experience? If I have my experience, I mean, what does it mean? Does it apply to everyone? Every human is individual. So what does research do? Research will apply the same method to 100 people or 1,000 people. More people are involved, better results we have. So if we apply it on 100 people, then we would know whether it has effect on 1% or 2% or 10% or no effect, right? So this is why research is needed to know the benefit of these
But
things,
right now there is no evidence.
We don't have any research. It does, we know this, it does lower cholesterol to some level. Okay. Does it lower cholesterol strong enough? Even in medication, we don't say that the whole purpose of eating is taking this pill. No, purpose is to lower cholesterol to a certain level. So I will tell my people, if they want to have this nuskha or this concoction, okay,
this remedy of heart,
whatever, you use it, okay, I know your cholesterol level now. You use this, come back after 3 months and show me your cholesterol
does
level.
it go down?
It does go down to some extent, but it will be variable from person to person. My target is your total cholesterol should be, if you have no heart problem, your total cholesterol should be less than 200. And your LDL cholesterol, which is the bad cholesterol, should be 100 or less. If it was 140 and with use of these it has become 100, okay, that's fine. Continue using it. But whatever you are using it, it's not curing the problem. It's only controlling the problem. The day you stop using it, cholesterol level will go up again. Okay. So you want to continue using it, but target is the level of cholesterol. The target is not a certain medication or certain nuskha. That's what we should remember.
Okay. Sir, now one of the last questions I want to ask you is that people join gyms, they do very hard exercises, and we have seen many deaths even on the treadmill, in the gyms, in the paddle court, and when people start the exercises all of a sudden with high intensity at an age prone to heart disease or a family history, what do you say?
I say at any age, when you start to exercise, start slowly, and as they call it, listen to your body. Don't overdo yourself. Listen to your body. Okay. So start gradually, and if you have any questions, any issues, you are having shortness of breath which you feel is out of proportion, you getting fatigued even with little activity, get yourself checked up before you continue with your exercise routine. If there are no concerns, gradually build yourself. Whether it is aerobic exercise, whether it is weight training, gradually build yourself. Excessive weight training for cosmetic reasons or for sports reason is a different thing altogether. It's nothing to do with health. You do need muscle building, muscle strengthening to a certain level for health, right? But overbuilding your muscles, does that have health benefit? It doesn't have health benefit.
So does steroid interfere with heart disease?
Absolutely.
Like in gyms, they give mega mass and other things which include steroids.
I absolutely prohibit it. It is not allowed even in the sports. It is for quick
Does it affect directly with the heart disease?
for overall health. It will increase the risk of diabetes, it will have your blood pressure going up, it will have other effects on your, so it has lot of side effects on, bad effects on your body. So steroid is absolutely no. Do not go for a quick fix.
Not even protein tablets, protein
Okay, now
capsules?
coming to the protein supplements.
Supplements.
Okay. Myself, I am not a supplement fan, and I don't think there is any evidence for health point of view for any supplement, including vitamins, to be used. So, I mean, there's no evidence in the medical literature for the supplements to be used. Advantage is in the diet. A good diet, a balanced diet, a moderate way, that is what helps. But if you want to build your muscles to a certain level, you will need extra protein. That extra protein should be cut from the diet, preferably vegetarian source or animal source, either way, whichever you have to have a balance of both. But if you are going to take supplement, that comes now for your cosmetic reasons or for sports reason, you should have a medical consultation to find out that you do not have any abnormality in the body which will become worse, like if you have high blood pressure, you have some problem with the kidney or kidney stone, the protein supplements may have more effect.
Like there is, it can affect with kidneys also and other things. Now my last question is, does COVID give any kind of effect to heart diseases or certain cardiac arrests?
In general, we do not have any evidence that in general COVID has increased heart diseases in general population. We don't have any. We have two evidences. There are some people who had a reaction to certain kind of COVID vaccine and they developed inflammation in the heart muscles and the covering of the heart, which is called pericardium. Some of those got better, some of them had long-lasting effect. But that was not a very common factor. There's some people, especially in young, they had this problem, reaction to a certain kind of vaccine. On the other hand, there are some people now we know has long COVID. So there are some people who are still having or reeling from the effects of COVID over many years. Now it's been 5
From the
3,
respiratory effects or from the cardiac effects?
Multiple, they have different effects on the body. There are some people have a respiratory effect. Some people just have general fatigue, lot of fatigue, severe muscle fatigue, and they are unable to work. There are some people who have effect on the heart. There are some people who have effect on the GI. There are some people who have effect on the brain also.
Brain, sight, joints, there are many
so there
manifestations.
are multiple effects which COVID had. It's called long COVID and it's still going on.
But it's not directly related to sudden cardiac deaths?
No.
Not at all?
Not at all.
No, and not also these jabs or
No.
COVID vaccines, they have not increased these cardiac deaths?
We don't have
You can
any
say with sure?
We don't have any evidence of that.
Okay. So thanks a lot. Thanks for joining us. We had with us Dr. Khawar Kazmi. He is the head of preventive cardiology at National Institute of Cardiovascular Diseases. I hope you would have found your answers to many of your questions. With this, I take a leave from you. Inshallah, see you next time in another podcast. Till then, bye-bye. Allah Hafiz.